Hi, I'm Annie, and I'm on the staff at NAMI Delaware. Thanks for tuning into this Facebook Live conversation. We'll be talking to Malia Boone about mental health crisis resources for children and youth in Delaware. But first, I wanted to tell you a little bit about our agency. NAMI Delaware is connected to the national agency called NAMI. That's National Alliance on Mental Illness. That is the largest grassroots mental health organization in the country. There is a NAMI in every state, and we are NAMI Delaware. So, to learn more about what we do, you could visit our website, namidelaware.org. But I'm going to tell you a couple of things first. So, we have support groups, we have education programs, we have a helpline that you may call and get referrals for various issues and questions you may have regarding mental health. But we also have housing. So you can learn more by visiting our website. And I will tell you that our support groups and education programs have not stopped during this time, during the pandemic. Instead, we've moved them online. So we are still offering support groups virtually, in a virtual setting rather than in person. And we're also offering education programs. One that is running right now happens to be one serving veterans and their families called NAMI Homefront. But we do have other programs to offer. And we also do private trainings and presentations, even virtually, for your organization, for your faith community, for your school community. So please reach out if you have any special requests regarding mental health education, mental health support, advocacy, or housing. Please reach out and connect with us. All right, I would love to welcome our guest, Malia Boone, now. Hi,
Hello.
Malia. Thanks for
Hi.
being here.
No problem.
Hi. So, first of all, thank you. And second of all, let's get straight what your agency's name is, because
Okay.
I know that it's changed a couple times. So why don't we start there?
Okay. So the crisis program at Delaware Guidance, there was a time when we were called Child Priority Response, but we are called Mobile Response and Stabilization Services now.
Right. Great, great. Thank you. And you just reminded me something I didn't mention that I should have, is that the conversation we have today may generate strong feelings in you, especially when we're talking about our children and the struggles that they may be experiencing and the needs in your family that may require you to seek additional support. So we want to make sure that you feel supported right now. So we
Yeah.
do have a banner to show you ways that you can reach out right now for immediate support. We have the crisis text line where you can text home to 741-741, or Delaware has a new opportunity called the Delaware Hope Line. And hopefully Malia can tell us more about that, but you can text DE Hope to 55753 to get crisis response here in Delaware. So let's start with that. Would you mind sharing a little bit more about that, Malia?
Sure. The state of Delaware has started their Hope Line, which is available to anyone in the state of Delaware that just needs to talk to someone. So if you're feeling overwhelmed, if feeling stressed, just feel like you need someone to talk to, the Hope Line is available, and it's available 24/7. People just call in and they're connected with someone who's there to listen and help.
And help, and then is it coordinating callers to various
Oh,
other
absolutely.
agencies throughout the state who might need, like they might need the connection to
Yeah, so they
something like
may
that?
be referred or
Hmm.
forwarded. They can even
Hmm.
forward the line to
Yeah,
certain providers that can be available immediately or in the near future.
great. And this only came about recently, right, with
Yeah.
the pandemic.
Yep.
Yeah,
Absolutely.
that's great. So another really important piece of our information right now
Yeah.
is look at what Delaware has done in response to the pandemic to try to connect people to crisis
Absolutely.
supports. So give me a little background on the work you do and how it like fits in the whole network of things in
Yeah.
Delaware.
Okay. So the crisis program at Delaware Guidance Services is contracted through the Department of Prevention and Behavioral Health Services. So we call that PBH for anybody who may not be
All the
familiar
letters.
with that terminology.
Yeah.
So PBH oversees the crisis program, and they also have multiple other types of services available that they assist with, that they contract with different providers to provide services in the community. A lot of those services are intensive services. So
Okay.
there are family-based services, community-based like IOP, intensive outpatient
Hmm.
services. There's family functional therapy and multi-systemic therapy. So there's different types of intensive community-based services. So part of what we do is within that network of providers, we can complete our role, which is
Hmm.
to provide a risk assessment and follow up and support a family in the midst of a crisis. But then we can also work together within that system to make sure that families and the children that are having concerns about are
Hmm.
connected to the appropriate services. So we're looking for outpatient providers, but also looking, do they meet criteria to be in those other services? And can we help them, connect with prevention and behavioral health?
Hmm.
Can we help them look at their insurance? Like some
Hmm.
families have private insurance that doesn't qualify for some of the higher level services. And then we can look at, does their child meet criteria for Medicaid for children who are disabled because of their mental health condition? So we can help families connect with these different resources.
So that kind of insurance that would work in a family who maybe has a private insurer, but
Yes.
then their child lives with a disability that qualifies them for this additional coverage, then
Yeah.
kind of opens a magic door to let them have some of these services that they
Yeah.
may otherwise never have known about.
Right.
That's
Because
phenomenal.
generally the higher level of care services that are offered through prevention and behavioral health are offered for children with no insurance or Medicaid insurance, but are available. And of course, if an insurance provider also covers that higher level of care service, that could be offered as well. But
Sure.
a lot of the private insurance don't cover those services, and this is an additional way. So we can help them kind of work through all that. We can connect them directly with PBH to help them figure that out. And I think that in that sense, that relationship, the work that we can do, not only what we do as a crisis program, but also as a way to connect with resources in the community is really important.
Sure. Speaking from my personal experience as a family member, as a parent,
Yeah,
um, when our family was experiencing a crisis, we didn't know about all the services available to us. Although
right.
we had um, private medical professionals who were helping us, and we were
Yeah,
seeing, therapeutic services that way, those connections weren't made for us.
yeah,
What would you recommend for families like mine? Should they
yeah.
just ask directly to their provider, or should they just call you?
I mean, I would first ask the provider because I think
Hmm.
that that's always when you're working with a provider, you have a relationship with that provider.
Hmm.
You want to figure out what's best for your family. And I believe that we have a wonderful array of resources in our community in Delaware that can provide wonderful services. And if it feels like your child needs something more, then
Hmm.
talk to your provider first. But if your child is doing something that has really got you concerned, is feeling like they're not safe or other people aren't safe, you can call crisis anytime. Now, we can complete a risk assessment, but we can also talk people through, what might be next steps. They might not need a risk assessment, they just might need a little bit of guidance, and they can call into our hotline for that as well.
That's great. So I'm going to jump ahead then to we had talked a little bit about the questions we might talk about. And I think
Yeah,
you just sort of segued into when we call that hotline. So your hotline's 24/7, right?
right.
And someone's going to respond. Who is it that's answering? Is it someone with qualifications that
Right.
meet, therapeutic levels, or what?
So we have two layers, I guess you could say, of
Okay.
crisis clinicians that you'll come in contact with. First, at our hotline, we have crisis clinicians that are just working the hotline to make
Okay.
sure that we have someone available all the time to be answering. So those clinicians are college educated, they're trained in empathetic listening, they're trained in crisis intervention and de escalation skills. So they are experienced in helping when you're in the midst of a crisis, because we certainly get calls from people
Hmm.
who are not doing okay, and
Right.
really need
Right.
someone to talk them through the challenge that they're going through right then. So our crisis call center clinicians are well prepared for that. And then you may then want a crisis risk assessment. And then when you get to that clinician, the majority of our clinicians in the crisis program are master's level clinicians, and they have a lot of experience in crisis intervention and therapeutic support. And so there's primarily masters in human services, a couple of bachelor's level, and many of our bachelor's level staff have extensive experience in working in crisis intervention.
That's great. So I can tell you again, like coming from my own personal experience, when my child is struggling, I'm struggling.
Absolutely.
So when family members are looking for supports, I can imagine that those calls aren't necessarily really calm and friendly because the caller is probably pretty distressed. And
Yes,
I
and that's
can tell you that's the way it was in our household.
absolutely.
So I think when the caller's making that call, and if they feel dissatisfied with any part of that scenario, if they feel like maybe their needs are different, what would next steps be if it didn't feel like it was going the way they wanted to go?
So they call into the hotline and they don't feel like they're really getting what they need.
Yeah.
So I would ask to speak to a supervisor if that were to ever happen, because we
Well, that
always
makes
have,
sense.
and we have supervisors available 24/7. All of our supervisory staff in the crisis program rotated on call, so we want to make sure that we always have someone available to consult with the
That's awesome.
clinicians, to consult with situations that are coming in to the call center. So there's always another level of person available that can make sure you're getting what you need.
That's awesome. Okay, good to know. And that makes sense, really. We want to do that in any kind of service situation if there just isn't a good match in some way. So thanks for clarifying that. So we've talked about who's answering the phone when we call. Let's talk about when do we call?
Yeah. So, and that, I think that's an important question to ask, because I'm not sure that everybody totally understands. I'm not sure that families know when it's
Right.
okay to call crisis. And there might have been a time where they called crisis and they were told that their child didn't meet criteria or something like that for crisis
Okay.
intervention. But it's so important for families to know that the way that we view the crisis service at this point is that the crisis is defined by the family. So whatever is happening.
Wait, say that again. That's so important. Will you say that again?
Yes, the crisis is defined by the family. So if you're worried about your child, if things don't seem right, there's concerning behaviors that have escalated, the child is not safe, they're suicidal, they've made a plan, they're self-harming, they're yelling and kicking and pretty like behaviorally having some struggles with keeping themselves feeling calmer, like they escalate easily. There's a reason why things change, right? It usually doesn't just happen for no reason. So if you're seeing those changes, you can absolutely call and ask for help. It doesn't have to be at an excessive or drastic point, in order to call for the crisis. We'd love to help you before it gets to that point.
Yes, very good point. Get upstream about it.
Yeah.
Yeah. When I'm getting all sorts of feedback, I don't know why. When it comes to the response you've seen since COVID, has it changed for you, like your numbers and that kind of thing?
Sure. So we always see a change in the number of calls we get in the summertime, because we get a lot of referrals from schools. Schools will see concerning behaviors or things that may be worrisome, or students will go to their teachers or guidance counselors and say, I'm struggling with this. And sometimes they don't tell their families, or sometimes families feel like they can manage it, or don't know who to turn to when they don't feel like they can manage it. So we always do get that, slowing down in the summertime of reaching out for crisis services. But since the COVID pandemic occurred, we have seen that same kind of slowdown.
Oh, okay. So even like in March and April.
Yes.
Okay.
So a typical year like 2019, we actually assessed 3,700 youth.
Okay.
Youth. So, and maybe a typical April or May is 350 maybe across the state. And we've had about half of that.
Okay.
So I guess my concern is I'm worried that families don't know that they can call us or don't know when to call us. And I want to make sure it's clear that they can call us anytime. Any concerns they have, they can call us for support.
That's a really great thing to say. And again, like, I know I keep saying from personal experience, but can I be honest? NAMI Delaware and our focus is to offer support and information from people who have lived experience. And
Absolutely.
because we know how hard it is, we've been
Yeah.
there. And I can tell you, those of you tuning in right now, if you're tuning in because you're a parent yourself, or if you're tuning in because you're a teacher, or because you're a neighbor or a friend of someone who has a child in their care who's struggling,
Yeah.
don't be ashamed. Don't be afraid. Don't be worried about judgment. Step in now and get ahead of it. Get upstream of it, right? And we can help intervene earlier in order to prevent bigger problems later, right?
Absolutely.
So you were describing some of the behaviors families might see.
Yeah.
I have a different one though, and I'm wondering if you would qualify this too. And of course, families define the crisis, so I guess
Right.
the answer is already there. But what about for the child or the teenager maybe who's just kind of lapsed out of communication with their family?
Yeah.
We've heard from some families who've had that happen during the COVID pandemic.
Yep.
The young person may have been, and I'm speculating, this is obviously hypothetical, but the concept being that they were very active and had lots of friends and different things,
Sure.
but because of the pandemic, they've sort of receded.
Yeah.
At what level of that withdrawal do they call you?
If they're concerned, they can call
Okay.
us, because I've certainly talked with parents or
Hmm.
guardians or caregivers who've
Hmm.
said, my child is acting different. There's
Hmm.
something different. But is this just because they're a teenager? This seems normal for teenagers, and they're not sure. And
Hmm.
sometimes it's hard to differentiate that, but it
Yeah.
doesn't hurt to seek
Mhm.
support, to call, have someone talk to your child, try to figure out what the concern might be. And withdrawal and social isolation and
Mhm.
sleeping a lot and all of those things, yes, that could be something that happens with a teen, but it also could indicate depression. It could indicate the child is being, anxious and
Mhm.
socially isolating because of the anxiety. It could be that they're feeling suicidal. So there's
Right.
sometimes we don't know, and it's important that we do whatever we feel like we need to do to support that child.
Right. So I think the overarching message here is if you have a feeling, that spidey sense of
Yeah.
something's going on, my
Yes.
child isn't, they aren't the way they used to be. Something has changed.
Right.
Make the call. It's not going to hurt
Absolutely.
anything, and it could, in fact, very much help in making um, further connections to other resources that could be helpful.
Definitely.
So once someone has called you and they've talked through different problems and that they're seeing, what might the next steps be? Would they perhaps immediately? So I can tell you as a parent myself, if I were to call, I would be worried that someone was going to show up in my driveway and take my child away.
Yeah.
Like that would be my immediate, like,
Sure.
because already I'm worried, I'm feeling stress as the parent, and I
Yep.
want to be protective, so I might not want to call you. So what
Sure.
what should a family member expect?
Yeah. So when you call into the hotline, you're talking with that clinician in the hotline who's kind of taking the information, listening for what you need, and they're going to connect you with a crisis clinician. Our crisis clinicians usually respond within the hour. So I want to make sure that it's clear
Hmm.
that it is usually a pretty immediate
That's
response.
pretty quick. Yeah.
We want to get out and help you
Hmm.
as soon as we can. But our crisis program, we don't want to take kids away from their families.
There. Yeah.
We know that children are better off at home and with their families. If we can make sure that continues and support you there, that's what we want to do. Now, we can also assess for the need to be placed in a psychiatric hospital,
Okay.
but that isn't our go-to. Like, we will go there because there's no other way to keep your child safe, but
Right.
we're not going to try to take your child away. We
Right.
really want to assess what the risks are, look for what the protective factors are, what we can put in place to keep everyone safe,
Hmm.
and how we can work together to kind of look at what is causing the crisis to begin with and really work through those things. And then in addition, get you connected to the resources that can maintain that stability and
Right.
keep you on the right path so that there isn't a need ever, hopefully, to have to leave the house.
Sure. Sure. And really, the name that you of your agency, mobile response and stabilization. That
Right.
term stabilization, that's the goal, right?
Yeah,
You're
absolutely.
you're you're focused on stabilizing the situation so that
Yes.
everyone is feeling better.
Right.
And I think equipping families with tools,
Yeah.
whether that is a set of strategies or actual phone numbers or a variety of different things.
Yes.
I certainly would have loved to have those resources when our family was going through what we were going through. So on behalf of other families like mine
Yeah.
who might not know of your availability, I implore you to consider calling if you are concerned. So are you available in all parts of the state?
Yes. So
Okay.
we have a location in all three counties. So we have like a base location in all three
Yeah.
counties, and we respond. Now, of course, in Sussex County, we when we think about how things are different, like our services are consistently the same.
Okay.
You call into the same call center, but you might get a different clinician that's dispatched out into the community. And the clinicians, are getting to you as fast as possible. Sussex County is pretty big. That's our
Yeah.
biggest, location in
Sure.
every
Stretch
county.
spread out. Yeah.
So that could cause a little bit of, change in the way that we get to you, because
Okay.
we might actually be more than an hour away from where you are, and
Hmm.
it might take a little bit longer. Those are the main differences. And then Sussex County also has fewer resources in terms of the providers that are available there.
Hmm.
But we're still going to work exactly the same way, and continuing to provide our own intervention, stabilization, and seeking out those resources that can get you connected quickly. And we're going to try to stay right with you until you're with those providers.
Right. So the family, once they're connected to you and you've responded in coming out or whatever,
Yeah.
should the family member expect that that person that's responded is going to be sort of their person from
Yes.
there on out? So are
Yep.
they like assigned in some way?
Yes. So we like to try to keep the clinician who does the assessment with the family, if at all possible.
Hmm.
Occasionally, we may transition to another therapist because maybe the one who came for the assessment doesn't have as much availability to
Hmm.
provide the support you need. Or maybe there's a day that you really want someone to see your child and that person isn't available. We'll send
Hmm.
someone else, but they work
Okay.
together as a team to make sure they're aware of what's going, that they're still working on the same things like building skills, developing plans for safety. And so we want to make sure like we have that 24/7 availability. And sometimes that means we have to have other people help out. But ideally, we have one person that stays with that family the whole time.
Okay. Well, that's good. And that certainly would be comforting, I would think, for the family
Yeah.
member to know that that person is their person or whatever. Yeah. So they're connected personally.
Yeah.
So are there ever times that, well, this is a two-parter. So are
Mhm.
there times that people shouldn't call you? Like there's another call they
So
should be making?
So the only thing that I could say would be a time maybe not to call. One is if there's a medical emergency.
Okay.
So if you have a child who's seriously harmed themselves or took an overdose of medications or something
Okay.
like that, you want to get emergency medical services for that child first.
Hmm.
We will still respond once the medical situation is stable, but we want to make sure that there's no risk to that child's life. So
Right.
that's the first thing. The second part is there are a couple of services in the community that part of their service is to manage and help families work through crisis situations. So one of the services is called family based. There's
Okay.
also multi-systemic structural family therapy. Those services, as part of the work they do, is really to be available to help families manage the crisis when they're in that service. So if they call into the hotline and we know they have those services, we're going to ask them if they reach their provider first, because we
Okay.
know that that's part of the work that they're doing together. And if they're having trouble reaching their provider, we'll reach out to them
Okay.
to make sure that because ultimately they've been doing a lot of work together to manage all of these things. And we'd like them to continue to be able to do that. But if we can't reach them, we will still respond because we want to make
So
sure that.
yeah, yeah. So these other two examples of services, how
Mhm.
would one get connected to those? Those sound very intense and
They are very
comprehensive.
intense. They're a very high level service, and most of the time that would go through prevention and behavioral health
Mm,
services. There are providers that contract with them to provide those services.
okay.
I know that there are some private insurers that can cover
Okay.
that type of service, but that would always be a question if you have a private
Got it.
insurance to check in with your insurance company to see what services they will fund.
Got it. Got it. So there are times then people shouldn't call you, and we covered those. What about if they call you and you've determined, the caller and the responder have determined that coming to your location isn't necessary? What might happen instead?
Well, I think there's two parts to that. One, right now with COVID, we have been providing telehealth services for the
Okay.
last couple of months. In with the stay-at-home orders and all of that, we've been providing risk assessments and follow-up sessions over telehealth. And now that Carney has started to open up the state and started to have like different businesses and things open more, and looking at that plan, we are starting to transition to more face-to-face sessions. So, you know, that's one thing I wanted to make sure I covered.
Okay. Okay. Okay.
That,
And just sort of
it,
rolling out slowly, I
right,
guess, right? Just
because
like
there
every
may
other
be,
agency is just gradually reopening. Yeah.
right. And there may be some families that don't feel comfortable with us coming to the home. So I wanted to
Okay.
make sure that was clear. I know that there are families that we've worked with that are concerned because they've been staying home and
Right.
they're worried about someone coming into their home and potentially bringing sickness with
Sure.
them or
Sure.
something like that. We can still provide telehealth services if that's the case. We can
So
still
you can
complete
do a
assessments.
risk assessment via telehealth in a
Yes.
safe way so that okay, that's
Yes.
good to know. That's good to know.
But there may be some other situations where family just doesn't really feel like they need that. And so we
Okay.
can talk them through what resources are available to them. We can let them know they can call if they change their mind.
Mhm.
If there's a situation in the future. I think that sometimes people do have a misconception that something has to be going on like right this moment,
Mhm.
for us to come. And that's not true either. But also, if nothing is going on right this moment, but you're not really sure what to do and you want to call and just kind of feel that out and get some questions answered, you can do that. And we don't have to come right then. We can tell you
Okay.
about resources. We can tell you how we can help if that were to be something you want. And that's it.
Right.
You can always call back.
That's great. That's great to know. And again, I would have really, really appreciated something like that.
Yeah.
Um, so you have other programs? I know COVID has probably impacted those other programs, but did you want to touch on any of those other services, like a therapeutic crisis intervention?
Oh, so I think it's important to like maybe focus a little bit on the service that we provide after the risk assessment and crisis. So
Okay.
we have our immediate assessment that we're doing to determine what are the concerns, how safe can someone be, what are the things that protect that child and protect the family, who are the resources available to them. So we're looking for all of those things. And
Hmm.
then usually we're either determining that they're just not safe at all to be in the community and they might need to be in the hospital, or they can open with us. We can provide some support to them, and it depends on what the family needs. We could potentially be available every day if needed, or a couple times a week, to
Okay.
provide that kind of like follow-up support. So we're going to be developing a safety plan. We're looking for
What,
ways to.
let's take a minute and tell people what a safety plan is in case
Sure.
they don't.
So we're trying to help the child figure out one ways that they can help themselves feel calmer, help themselves feel like they can get through when things get really bad. So for instance, if a child's suicidal and they're having suicidal thoughts and we want them to get through that moment, what are
Hmm.
some strategies they can use? So we try to find, coping skills and anger management and conflict
Hmm.
management and problem solving skills. So we're looking at skills they can do internally, but also who are the people they can turn to that help them through when it gets really bad. And maybe who shouldn't be there because
Hmm.
they don't
Maybe
help,
it's
or
not a
maybe
good, yeah, it's not a good
or
match. Yeah.
yes. So just trying to figure out a plan for when things are getting bad, what can we do to keep you and everybody else safe?
And does the clinician respond to the parent or the caregiver at that point too? And like I'm looking at, say, for example, me, would
Yes,
I have been given strategies, coping skills, all those things
absolutely.
too?
Yes,
Okay, so this is really more than just treating the youth. This is
absolutely.
like
It's
serving the
huge.
family.
Hmm.
Yeah. And what
Yeah,
about if
because
they're siblings? Would that be a part of it or no?
So we work with siblings. Sometimes we'll
Okay.
open a case with two siblings at the same time because they're
Okay.
both in crisis, and then we just
Yeah.
work with the family together and,
Yeah.
still develop plans specifically for those kids, for those youth, but within the context of the family, like how can we support each other?
Hmm.
Um, Safety planning is a huge part of what we do. And then we're just continuing to work with families around all of those same kinds of things like de escalation skills and coping strategies and problem solving and conflict management, distress tolerance, like when somebody's getting really, really upset, how do we help them like tolerate those horrible feelings that feel like a
Right.
wave crashing over them? We can work with them to
Right.
figure those things out. And then in the meantime, we're also looking at what are the long term goals here and what kinds of services should we have in place? What resources do you need? And we're helping
Yeah.
them connect with those two.
That's great. That sounds like a really good match to something we have called NAMI Basics, which is a
Yeah,
class that teaches parents and caregivers about mental health conditions for of children. It
yeah,
teaches the science behind it and also communication strategies and
absolutely.
tools that families can use to help manage the day to day as well as a crisis should it happen.
Absolutely.
That would be a good fit. And also a family support group.
Yeah,
That's a place, that's actually the first thing I did when I learned about NAMI. It was through the support group where I walked in and I was actually with other family members who had been there. And I could actually tell them what happened in our home
yeah,
without shame.
right.
And it was so overwhelmingly supportive.
Yeah,
And that's, it's hope
so
just
needed.
opens then, right? But
Mhm.
we need to work together in these things, and
Yes,
knowing what you do in your agency and how you serve families, I feel like they go hand in hand.
absolutely.
Yeah. Well, I hope those of you who've tuned in, if you had any questions, I see Wesley's been posting lots of comments about links and response opportunities for people to access later. And certainly you can follow up with us via email. I think the easiest email maybe might be admin at namide.org. We can certainly forward those on to Malia if they come to you for questions.
Absolutely.
But we want to thank you so much, Malia, for joining us today and for helping share this important information for families in the state of Delaware. And we look forward to connecting with you again soon.
All right. Thank you so much, Annie.
Take care.
All right.
Bye.
Bye.